Avoidable hospital transfers of long-term care residents cost taxpayers millions of dollars in America. Even more troublesome, it places long-term care residents at greater risk for complications and adverse effects. Research shows that 60 to 80% of unnecessary hospital transfers from long-term care facilities are related to 6 different diagnoses that can be prevented by early detection and on-site treatment. Our research project is called the Missouri Quality Initiative, or MOQI. The project began in 2012 when the MU Sinclair School of Nursing was awarded a $14.8 million grant to work on 4 goals. 1. Reduce potentially avoidable hospital transfers from nursing homes. 2. Reduce costs of Medicare expenditures for beneficiaries. 3. Increase the use of advanced directives for end-of-life decision-making. 4. Reduce the use of antipsychotic medications among people with dementia. To achieve those goals, the MOQI team developed a plan that focused on placing advanced practice registered nurses, or APRNs, into 16 Missouri nursing homes with high hospital transfer rates. The APRNs worked with their staffs to develop early illness recognition skills that detect condition changes that precede acute illness among the elderly. As a result, the MOQI team came up with 11 clinical interventions to prevent hospital transfers and provide the quality care our elderly deserve. 1. Introducing APRNs to long-term care. 2. Managing polypharmacy and antipsychotic use. 3. The importance of hydration in long-term care. 4. Using Interact tools in long-term care. 5. How APRNs prevent falls. 6. Using feedback reports. 7. Reducing infections in long-term care. 8. Role of APRN in long-term care. 9. Honoring residents with dementia. 10. Physician engagement. And 11. Advanced directives. After implementing these interventions for 3 years, it was found by an independent contractor these costly and debilitating outcomes significantly improved. 40% in all-cause hospitalizations, 54% in all-cause ED visits, 34% in Medicare expenditures for all-cause hospitalizations, 50% in Medicare expenditures for all-cause ED visits, 58% in potentially avoidable hospitalizations, 65% in potentially avoidable ED visits, 45% in Medicare expenditures for potentially avoidable hospitalizations, 60% in Medicare expenditures for potentially avoidable ED visit. The data show that if these clinical interventions are done in all nursing homes in Missouri and across the U.S., they would revolutionize the healthcare outcomes in long-term care. Life would be better for the elderly, and it should be.